The coronavirus pandemic results in big economic losses for China. We'll discuss what it means for Beijing and the rest of the world. Hello, I'm Anand Naidu, and this is The Heat. China faces the worst economic losses since 1979 after shutting down the country to fight COVID-19. The world's second largest economy shrank 6.8% from 1 year ago, and analysts say recovery could take longer than expected. The International Monetary Fund says China will eke out modest growth of 1.2% this year. The United States wiped out a decade of job gains with 22 million workers applying for unemployment benefits. U.S. President Donald Trump outlined plans on Thursday to reopen the economy, but said the ultimate decision will come from individual states. CGTN's Nathan King joins us now from the White House. Nathan, Donald Trump just spoke once again about the plan to reopen the country, but before that took to Twitter to call for what he called the liberation of certain states. What can you tell us about this?
Yeah, it's been a bizarre day, even in the history of this administration and with the backdrop of COVID-19. Yeah, remember at his briefing yesterday when he basically said, governors, you call the shots. Well, he's been taking shots, at various governors, liberating those states, essentially seeming to encourage demonstrations that were taking place to protest stay-at-home measures and also measures to not open up the economy as quickly as some would like. What it seems to be is that the US president, after saying go it alone governors, he's now sort of refereeing who's doing well, who's doing badly. And unsurprisingly, he's pointing fingers at states that have Democratic governors. This is sort of a dress rehearsal for what we're going to see in the run-up to the November election. But I can tell you a lot of states are pushing back. Andrew Cuomo, the New York governor, really hammering hard today, saying, look, we think this whole plan is essentially an excuse for the US to stop supplying testing. And we need testing supplies if we're going to get people back to work. And there was a phone call with Democratic senators here today, which apparently did not go well, all on the subject of testing with Vice President Mike Pence, the leader of the coronavirus task force. So what we're seeing here is a deep division still, not just between the federal government and states, but also the federal government and states that are run by Democrats as well. And what's interesting here is that some states are starting to move up to open up already. Texas announced a phased plan. But if you look at Florida, for example, some of the beaches are going to be open this weekend, Anna.
Right. Thanks, Nathan. That's CGTN's White House correspondent Nathan King reporting there. Well, for more now on how COVID-19 is impacting the global economy, let's bring in our panel. Joining us from Beijing is Einar Tangen. He's an economic and political affairs commentator. From Washington, D.C. via Skype, Arthur Dong is a teaching professor with the McDonough School of Business at Georgetown University. And Frank Sesno is the director of the School of Media and Public Affairs at George Washington University. Thank you to all of you for being with us. Einar Tangen, let me start with you, and let's start talking about the Chinese economy. As we just heard, the economy shrank by 6.8% in the first quarter of this year as the country battled the COVID-19 virus. So put this in perspective for us, Einar. How serious is this for China?
Well, it's obviously serious anytime you have a negative 6.8% growth, but there are some highlights and some issues that need to be resolved. The highlights was that industrial production was only off just a little over 1%, but there was concerns about the disposable income down 4%, a number of other areas, especially in fixed asset and investment, down, also obviously retail down. So right now, everybody's looking at China, what does the recovery from COVID-19 mean? How long does it last? And there seems to be this kind of general formula. You have to take the amount of time that it takes to control the virus and then measure the damage and then figure out your recovery response. People are looking forward very much to what's the Chinese government's response is going to be. They have a package that's probably going to be rolled out very shortly, probably next week, and that will give a very good idea of how they intend to approach it. Up till now, it's been really about preserving businesses, loans, some grants, etc., trying to make sure that these companies don't go out of business. There's some anticipation that the next package will be some way of encouraging consumer confidence and putting more money back into the hands of consumers so they can restart this consumption engine.
As you say, Einar, everybody is looking at China. No doubt the rest of the world will be looking at China. This is a country which has the second biggest economy in the world. It also is a major player in the global supply chain. So how will this contraction in China impact the global economy?
Well, right now, China, because it's emerging, is going to be one of the few nations, for instance, with the PPE, the supplies that are necessary for protective equipment. China can now turn those out full volume, and they can send them around the world. So China is going to continue to be, especially during this down period while things are getting settled around the rest of the world, China will be the production center. Now, in terms of logistics, things are not as smooth as they could be. Obviously, getting things in and out of China takes a lot more time and effect. You're hearing some indications that some governments, on one hand, they complain that China, they got some shoddy goods from some backroom deal that they made with some unknown supplier, but when China stepped in to make sure that everything was certified, then you get complaints that just said, oh, look, you're holding things up. So China's in a difficult position where everybody is relying on it, but it's a kind of a passive, aggressive thing for a lot of countries, especially the U.S.
Arthur Dong, the United States economy is also in free fall. We had those astounding figures come out earlier this week. More than 22 million Americans in total have now filed for unemployment benefits. Could this get a lot worse?
Absolutely. Part of the reason, and certainly I agree with a lot of the statements that Einar just made, but with regard to the United States, they're in a tough spot right now. All the news, when you look at all the key economic data that has been coming in for the month of March and certainly for the first quarter, are what we would describe as being disastrous. Right now, the unemployment rate is around 10%, with 22 million job losses, all of which occurred in the last 4 weeks. It's the largest drop that the United States has ever experienced since the Great Depression. But more importantly, when you look at selectively amongst the states themselves, particularly those states that are in the battleground regions that Trump had captured in 2016, those numbers are a complete disaster. I'll give you some numbers, Anand. Michigan, unemployment rate is 21%. Pennsylvania, 20%. Ohio, 15%. California, 14%. Kentucky, 19%. And the list goes on and on. So I expect greater registrations for unemployment simply because the state systems have not been able to keep up with the demand and the amount of unemployed that have been trying to get through those 800 numbers and to actually file their claims online. So there's a great deal more pain that's going to be coming ahead soon.
All right, let's bring in Frank Sesno. Frank, great to have you with us again. As we just heard, this pandemic is having a great impact on politics in this country. In fact, earlier this week, there was a bit of a controversy when President Trump said that he was the sole person that had the authority to reopen the economy. Let's listen to part of what the president had to say.
Let me just tell you, very simple. I'm going to put it very simply. The President of the United States has the authority to do what the President has the authority to do, which is very powerful. The President of the United States calls the shots. If we weren't here for the states, you would have had a problem in this country like you've never seen before. We were here to back them up, and we've more than backed them up. We did a job that nobody ever thought was possible.
So, Frank, the president did later back down on that and said that, in fact, it is the governors who have the prerogative to reopen the economy in their states. But the question is, why is the president picking these kinds of fights? And to what extent have these coronavirus briefings that we see every evening really become political rallies for the president?
He picks the fights because that's what he does. It's what he's done as a candidate. It's what he did before he was a candidate. It's what he's done as a president. He hasn't seemed to get the memo yet that when the country is at a moment of maximum peril, you actually stop the fighting and you are the great uniter. You are the commander-in-chief over the armed forces, and you're the consoler-in-chief over the American public. It's certainly everything that we've seen since I've been covering presidents and been here in Washington, but not now. Why is he doing this in this way at this time with these briefings? Well, you know, in a funny way, he's turned these briefings into sort of a substitute for his rallies, where he used to be able to go out and bark these sorts of comments to his base, to his followers, and they would cheer and clap and scream. He doesn't have that kind of audience now, and I think he craves it. And so he shoots from the lip. And, you know, his comments about what is the power of the president are just flat wrong. That's not what the Constitution is. He was, you know, slapped for that and then backed off the next day. And today he's, you know, calling for virtual, you know, protests in some of the states where there are governors that he doesn't like or who are his opponents. This is the way he is. It's actually, we'll see, but I think it's a short-sighted political strategy, because yes, it will rally his base, but it will also rally those against him. And for someone who's running a re-election after winning an election last time that he won by such a narrow margin, he could be, you know, alienating more people than he should be at this point.
One other issue, Frank, and this is something that's posing a dilemma for journalists. National television media in the country are now grappling with whether they should take these coronavirus briefings every evening, whether they should take them live. What are your thoughts on that?
I actually have very strong feelings on this, and it's probably somewhat controversial, but so be it. When I was at CNN and a president went to a political rally, we would have a conversation. Sometimes it was off the record, sometimes it was on the record, with the press secretary or others at the White House to assess the news value of the event. If there was news that we knew was going to happen, we would figure out, is that going to be throughout the speech? Is it the top 2 minutes? What is it? I don't think it would be a terrible thing for networks to say to the White House, we need guidance as to what the news is going to be. Our policy is we're going to take 10 minutes, 15 minutes, but we are not going to take 2 hours. You get to a point when he's going on for 2 hours and 11 minutes in one of these things,
right,
where there's no new information being provided. And in fact, in many cases, there is disinformation being provided. It's dicey business for the networks, because if any of them do decide not to take one of these events, they open themselves up to all kinds of accusations of partisanship. But the president has demonstrated again and again that these briefings are not often filled with information, and I think there needs to be some discipline here.
I know. I want to get back to China, and China has revised the numbers on the death toll in Wuhan. 3,800 people are now known to have died. Was this done in response to closer international scrutiny of those numbers coming out of China?
Oh, absolutely not. I mean, look, I mean, everywhere around the world today, you're seeing a revise of all the death numbers and also contagion numbers as they learn more. I applaud Wuhan for coming forward, especially in a toxic environment where, of course, everyone would say, oh, this was due to international pressure. Fact is, for scientific purposes, it is absolutely necessary to establish what the mortality rate of this virus is, and you can only have that through transparent information. China is really going overboard trying to make sure that things are in fact transparent. Unfortunately, it's never going to be enough. No matter what happens, there's always going to be a conspiracy theory.
Okay. Arthur Dong, United States Airlines have taken a battering. Most fleets have been grounded. They did come to a $25 billion deal with the Trump administration. Only 30% of that will have to be paid back. But could we see some airlines go into bankruptcy?
Yeah, I think many airlines already are facing technical bankruptcy as these days and weeks continue to go on. You look across the board, the landscape of the airline industry, it's been devastated. Certainly tourism and all manner of travel has come to a complete standstill globally. And we have CEOs of major airlines just recently starting to prepare their employees for not only furlough, but potential permanent separation and, firing. And so the airline industry, across the board is really feeling the pain. Cathay Pacific just announced yesterday that they're closing all of their U.S.-based operations and closing all their offices and laying off several hundred employees in the United States. And so the pain in the airline industry is going to continue. without a meaningful end in sight, I'm afraid.
Okay. Frank, we were talking about the presidential election. We see a lot of Donald Trump at these coronavirus briefings. We don't see much of the presumptive Democrat candidate, Joe Biden. How will this pandemic really impact the election that's coming up in November?
It's so hard to tell. I mean, one would think that it's going to be a very difficult challenge for Donald Trump. Wherever the economy is, it's going to be in a lot worse shape than it was 6 weeks ago when he was bragging that it was the best it's been in 50 years. And again, when you win such a narrow election as he did last time, and you've been such a divisive president, the one thing that you've got, which is that economy, you want to take with you into the campaign. He won't have that. He will also be pilloried for the kind of delay and the very kind of divisiveness that we were talking about here earlier. However, as you say, where is Joe Biden? Joe Biden's in his basement. Joe Biden's talking to a Skype camera like I am. Joe Biden is not out with the crowds because there are no crowds. And Joe Biden has no bully pulpit beyond a candidate's pulpit. He can't actually do anything. So it's a very, very uncertain landscape. And if Trump can make people somehow, I wouldn't be surprised to see him turn against the medical officials who've advised him and blame them for the economy. He's a blame first politician, and he'll do that. How that plays as it goes forward is anybody's guess. It should be much, much more difficult for him if the normal rules of politics still apply.
Very quickly, Frank, I've only got about 15 seconds. What are your thoughts, very quickly, on the president's decision to cut funding to the World Health Organization?
Plays to the America First crowd. It plays to his crowd. It doesn't play to anybody else. He's been pilloried by a lot of people of great stature here and elsewhere. And if in the end, people can connect this to, if you don't help the world, you hurt America because it promotes the virus and it endangers American lives, it won't play well long term.
All right. Well, thanks to all of you for being with us. Thank you. Now, while some U.S. states look to reopen, New York Governor Andrew Cuomo is extending his state's stay-at-home order until May 15th. New York has suffered the worst losses with over 12,000 deaths. Earlier, I spoke to Dr. Saqib Rahim, a healthcare executive and internal medicine physician, about his experience on the front lines.
Yeah, I think it's been incredibly difficult. It's probably been the most challenging thing I've seen in my clinical career. We've seen things that we've just never seen before. And it's incredibly difficult because patients have been coming. I've been working since the first day of the pandemic, and it was a slow trickle at first, and then suddenly it was like the floodgates opened. And these patients were really ill, some of them. And unfortunately, there were many who did not make it, and family was not able to be there. And that was incredibly tragic.
You said that you've lost at least one patient every day over the past week. At times, do you feel overwhelmed or even helpless?
Yeah, I mean, I think it's inevitable when you see so many patients passing that you do feel helpless because you wish that there was more you could do for these patients. But with that said, we've really tried to do everything we can, but we've never seen anything quite like this virus.
You have posted some of your experiences on LinkedIn. You've called it COVID Chronicles. Some of the stories are very sad, some are very tragic, others are very heartwarming. Tell us about the story that's affected you the most.
Yeah, no, I mean, I think the one that really stuck out to me was I had an elderly patient who we ultimately had to intubate, and I had to call his daughter to inform her, and she's a physician herself. And she just started bawling and was just so distraught, and asked me that before we intubated him, if I could go in the room and whisper in his ear that she loves him, just in case those were the last words he ever hears. And that really jarred me because it made it, although I had already recognized the gravity of the situation, you see it from the perspective of a family member and loved one. And the anguish they were feeling and not being able to be there with someone that they really care about, and knowing that there was a possibility that this individual was not going to make it.
What about the patients who've come to the hospital and who are full of fear because they've now got the virus, very little is known about it and how it behaves? What was that like?
Yeah, no, it's tough. I remember one of my first patients, because I was working since the first day of the pandemic, when I remember walking into her room and telling her that she was COVID positive, and it was this this elderly Hispanic woman, and she just kind of looked at me really sad with tears kind of welling up in her eyes, and she said to me in Spanish, she asked, "Am I going to die now?" And that was in, the first few days, and it was really hard to see that level of fear and try to let them know that the vast majority were going to be okay, but recognizing that this was really scary to be on the other side of. And since then, we've seen that, unfortunately, there's a lot of patients, many of whom we did not expect, who have not made it through. And that's never easy to go through.
There's been lots written in the media about the shortage of personal protective equipment for doctors and other healthcare workers, known as PPE. This puts you, of course, in grave danger. What's been your experience?
I know I've read a lot of the similar reports. I will say the hospital that I've worked at, I think, has done a really exceptional job of trying to make sure that we've been safe. But it's a very real concern, because I've seen the stories out of other hospitals. And given how transmissible this virus is, I think that the concern of having proper protection for healthcare workers is very real, because when you're on the front lines and you have that level of exposure, there's always that risk. And so I've been very fortunate that I haven't personally experienced that shortage, but I fully believe the stories that I've seen from healthcare colleagues elsewhere that have.
What are the kinds of precautions that you take?
I'm very careful about making sure that I have my full protective equipment on anytime I'm going anywhere near a patient area, making sure to wash my hands, constantly, trying to avoid touching my face or my eyes, as well as making sure that I have a mask on, even when I'm not in patient areas and even when I'm in public. I think that every little thing that we can do is important, because unless we can slow down the spread and flatten the proverbial curve, this is something that really could end up just running rampant through society. And so I urge people who are not just healthcare workers to be hypervigilant.
There are still many people who don't take this pandemic as seriously as they should. We still see people gathering around in groups. In fact, there was a report earlier today that some of the beaches in Florida are going to be open. There'll be limited openings, probably in the mornings and the evenings. But a lot of people are not taking the kinds of precautions that they should. What is your message to them?
As someone who's seen this, and today is my first day off in 36 straight days, which was my choice, I would really caution those people to take this very seriously, because this virus is not the flu. It is far more significant, and we are not out of the danger zone by any stretch. If we ease social restrictions and physical distancing, it is very well possible that we could see another spike. And so I recognize that people are getting very restless, and I myself am feeling that way. But with that said, I understand that there's still a lot more that needs to happen and that we're not out of the woods. And so I would urge those people to continue to be very cautious. And if they do feel the need to be out in any kind of remotely public spaces, to maintain physical distancing, to maintain wearing masks, and to take this very seriously, because I've seen things in the month plus that I've been working that I've never seen before clinically, and I hope to never see again.
You were there right there on the front lines, and there's some confusion of how this virus behaves insofar as whether it affects older people and younger people differently.
Yeah, I mean, obviously, those who are older and have more comorbidities are most likely to be vulnerable. But one of the most surprising things about this virus has been the number of younger patients and those that don't have comorbidities who have been incredibly ill and even passed. it's not just a virus that affects the elderly. I've had to intubate patients in their 30s and 40s that I would never have expected under other conditions. And so I think there's a lot we don't understand about this virus and the way it behaves and why it impacts certain groups more than others, especially minorities. We found that it disproportionately has affected the Black and Hispanic population, but that doesn't mean that other people of other races who don't have significant comorbidities or are not previously ill aren't potentially at risk of very dire consequences.
You know, there has been guidance given to us from the White House, from governors as well, to ease the restrictions in some parts of the country, not all over, but in some parts of the country. But even if that is done, how important would it be for people to still maintain these other guidelines, like social distancing?
I personally believe that it's incredibly important. I understand that the government and governors may want to start opening up the economy. But with that said, I think it's absolutely imperative that we listen to the public health and clinical experts and really be extra cautious, because as I said, this thing is far from over. And if it were to have a resurgence, it could have really dramatic effects on all different types of people. And so, although I, like everyone else, would love to get back to some semblance of normalcy, I think the concept of normal is going to be very different for the foreseeable future, and it should be.
What do you make of the fact that the New York governor, Andrew Cuomo, says that the number of people being hospitalized is actually going down?
Yeah, I would say my own experience is that it is starting to plateau, and we have seen a proverbial flattening of the curve in New York, which is comforting. But if you think about, this is more than 3 weeks after we issued the stay-at-home orders, and so there's been a significant lag, and there's always the concern that as cities and states start easing those restrictions, that there's always the risk that the hospitalization rate could go up. So I think that we need to be extra cautious, and we need to recognize that there's still a lot of the story that will need to be told moving forward with this virus. But it is encouraging that at least in New York, I'm optimistic that we've hit the peak of hospitalizations. Now the goal is, how do we keep it from rising back again?
Dr. Saqib Rahim, thanks for joining us, and we wish you well.
Thank you. My pleasure.
And that is it for this edition of The Heat. We leave you now with a tribute to medical workers from New York to Wuhan who've worked tirelessly to save lives. I'm Anand Naidu in Washington, D.C. Thanks for watching.